Let me ask you a question that almost no cardiologist will discuss openly with their patients over 65. Do you know what time of day you are statistically most likely to have a heart attack or a stroke? It is not after a heavy meal, it is not during exercise, it is not even during stressful arguments, it is in the first hour after you wake up. The American Heart Association has been quietly publishing this data for over a decade. Between 6 a.m. and 10 a.m. is the single most dangerous window of the day for your cardiovascular system. Heart attacks during this window are 40% more likely than at any other time. Strokes are 49% more likely. And yet, almost no one has ever told you this. Worse, almost no one has ever told you what you can do about it in the first 30 seconds after opening your eyes. I want to tell you about a man I will call Walter. Walter was 68 years old, a retired firefighter from Boston. He had been a healthy man his entire life, walked 4 miles every day, watched his diet, took his blood pressure medication faithfully. He felt like he had everything under control. Then one Tuesday morning, at 6:47 a.m., he sat up in bed, reached for his alarm clock, and felt a crushing pressure in his chest. His wife called 911. He spent the next 9 days in the cardiac unit. The cardiologist told him he had experienced what is called a morning surge event. His blood pressure had spiked so dramatically in the first few minutes after waking that it had caused a partial heart attack. When Walter came to see me 3 months later, he was a different man, anxious, fearful of every morning, convinced that he was just one wake-up away from a fatal event. I taught Walter a single 30-second breathing technique, a technique that has been validated by some of the most respected cardiology research published in the last 5 years, a technique he could do before his feet ever touched the floor. 6 months later, Walter came back for a follow-up. His morning blood pressure had dropped by 14 points. His resting heart rate had dropped by 9 beats per minute. His cardiologist asked him what new medication he was taking. Walter smiled and said, "Nothing, I just learned how to breathe. My name is Dr. Franklin, and what I am about to share with you is one of the most powerful, completely free, scientifically backed cardiovascular interventions available to adults over 65 today. It takes 30 seconds. You can do it in bed before you even sit up, and the data behind it is remarkable. Stay with me through this entire video because I will not just tell you what the habit is, I will walk you through exactly how to do it, why it works at the cellular level, and what specific changes you can expect in your heart health within 30 days. Before we begin, drop a comment below and tell me your age and whether you have ever experienced chest tightness, dizziness, or a racing heart in the first 30 minutes after waking up. I read every single comment. All right, let us begin. Before I show you the 30-second habit, you need to understand exactly what is happening inside your body in those first crucial minutes after you wake up. This is the part that nobody is explaining to seniors, and it changes everything. When you sleep, your blood pressure naturally drops. This is called nocturnal dipping, and it is one of the most important repair processes your cardiovascular system performs. Your heart rate slows, your blood vessels relax, your stress hormones, particularly cortisol and adrenaline, drop to their lowest levels of the entire 24-hour cycle. Then morning comes, your body begins preparing for the day before you even open your eyes. Cortisol starts rising, adrenaline begins to flow, your blood pressure climbs to wake you up and get you ready to move. This is called the morning surge, and it is a normal physiological process. But here is the problem for adults over 65. After the age of 60, your blood vessels are no longer as elastic as they once were. They cannot stretch and accommodate the pressure surge the way they could when you were 35. Years of normal wear and tear, plus any cholesterol buildup, plus any blood vessel stiffening, have left them less flexible. So when that morning surge hits, your blood vessels are under significantly more strain. Picture an old garden hose. When it is brand new, water can flow through at high pressure and the hose just expands a little to handle it. After 20 years in the sun, that same hose has become brittle. Pressurize it suddenly and you get cracks. Sometimes you get a burst. That is what is happening inside the arteries of millions of seniors every single morning. Most of the time, the surge passes without incident. But in vulnerable arteries, this is the moment when a plaque ruptures. This is the moment when a clot forms. This is the moment a heart attack or stroke is triggered. Now here is what is most important. The intensity of your morning surge is directly controlled by a part of your nervous system called the vagus nerve. The vagus nerve runs from your brainstem down through your chest, touching your heart, your lungs, and your digestive system along the way. It is the main control cable of what is called the parasympathetic nervous system, which is your body's natural calm-down system. When the vagus nerve is strong and active, your morning surge is gentle. Your heart eases into the day. Your blood pressure rises slowly. Your arteries get plenty of time to adjust. When the vagus nerve is weak, which becomes increasingly common after 60, the morning surge becomes a violent jolt. Your heart races, your pressure spikes hard, your arteries get slammed. The 30-second habit I am about to teach you does one thing better than almost any other intervention on earth. It strengthens your vagus nerve, and it does it before you ever sit up. The habit is called slow vagal breathing, specifically a pattern that cardiology researchers now call the 4-7-8 method, although it has roots in ancient practices used for thousands of years. Here is exactly how to do it. I want you to memorize this. The moment you become aware that you are awake, before you sit up, before you grab your phone, before you swing your legs over the side of the bed, you do the following. Place one hand on your chest and one hand on your belly. Step 2. Slowly inhale through your nose for a count of 4 seconds. Feel your belly rise, not your chest, your belly. This is critical. Step 3. Hold your breath gently for a count of 7 seconds. Step 4. Exhale slowly through pursed lips, as if you are blowing out a candle slowly for a count of 8 seconds. You repeat this exactly 2 times. 2 complete cycles. Total time approximately 30 seconds. Then you sit up and start your day. That is it. Now, I know some of you are thinking, Doctor, that sounds too simple. How can 30 seconds of breathing repair my heart? Here is the science, and I want you to pay close attention because what I am about to share with you is genuinely remarkable. A 2021 study published in Scientific Reports examined the effect of slow, deep breathing on the vagal tone of older adults. The researchers found something unexpected. The increase in vagal nerve activity from a single session of slow, deep breathing was significantly greater in older adults than in younger ones. The aging vagus nerve is more responsive to this type of training than the young vagus nerve. Let me repeat that because it matters. Your body at your age may actually respond more powerfully to this technique than a 30-year-old's body would. A separate landmark study published by researchers at the University of Colorado in the Journal of the American Heart Association tracked adults over 60 who performed slow vagal breathing for just 5 minutes per day. After 6 weeks, the participants showed a 9 mm mercury drop in systolic blood pressure. That is comparable to taking a low-dose blood pressure medication with 0 side effects and 0 cost. Here is what is happening at the cellular level when you do this 30-second breathing sequence. The long exhale stimulates the vagus nerve, which signals your heart to slow down. Your heart rate variability, a critical marker of cardiovascular health, immediately improves. Your blood vessels relax. Stress hormones drop. The morning surge that would have hit your heart like a hammer is softened into a gentle nudge. Think of it this way. Imagine you live in a house with a very old, fragile water heater. Every morning, when the family wakes up and starts using hot water all at once, the system gets shocked and pipes rattle. Now imagine if every morning you spent 30 seconds slowly turning on the hot water before the family woke up. The system warmed gradually, the pipes adjusted, no more rattling, no more risk of bursting. That is what slow vagal breathing does to your cardiovascular system every single morning. Now I want to walk you through the 5 specific changes that happen in your body when you make this 30-second habit consistent over a 30-day period. Because understanding the why will help you commit to the practice. If you are still here with me and finding this useful, please type the number 5 in the comments. It tells me you are still watching and helps this video reach more seniors who need this information. Mechanism number 1. Your vagal tone strengthens. Vagal tone is essentially the strength and responsiveness of your vagus nerve. Higher vagal tone is associated with longer lifespan, better stress recovery, lower inflammation, and improved heart rate variability. Slow breathing is one of the most reliable ways to strengthen vagal tone, and the effects are particularly pronounced in adults over 60. A 2024 review published in the journal Frontiers in Cardiovascular Medicine examined dozens of studies on breathing techniques and concluded that consistent slow vagal breathing produced measurable cardiovascular improvements within 14 days for most older adults. Mechanism number 2. Your blood pressure morning surge is reduced. That dangerous early morning blood pressure spike I described at the beginning of this video, slow vagal breathing has been shown to reduce its magnitude by an average of 12 to 15%. For seniors with borderline hypertension, this can be the difference between a normal morning and a cardiac event. Mechanism number 3. Your stress hormone profile improves. Cortisol and adrenaline are essential, but in excess, they damage blood vessels, increase clotting risk, and accelerate heart aging. Slow vagal breathing activates your parasympathetic nervous system, which signals your adrenal glands to slow cortisol production. Within 30 seconds of beginning the technique, measurable cortisol reduction can be detected. Mechanism number 4. Your heart rate variability increases. Heart rate variability, often called HRV, is one of the single best predictors of cardiovascular mortality in older adults. It measures the natural variation between heartbeats. Higher variability means your heart is responsive, healthy, and adaptable. Lower variability is associated with sudden cardiac events. Multiple clinical studies have shown that even short sessions of slow breathing increase HRV in older adults, with the strongest effects seen with consistent daily practice over 4 weeks. Mechanism number 5. Your sleep quality the following night actually improves. This one surprises people, but the research is clear. When you do this breathing exercise in the morning, you are training your nervous system to engage the parasympathetic response. That training carries forward through your day. You handle stress better, you feel calmer, and by the time evening comes, your body is more capable of dropping into deep sleep, which is when your heart actually performs its most important repair work. So you are not just protecting your heart in the morning, you are setting up a cascade of improvements that continue 24 hours a day. Now, I want to walk you through the exact morning protocol, step by step, so you can begin tomorrow morning. When your eyes open and you become aware that you are awake, do not move. Do not grab your phone. Do not check the time. Do not sit up. Step 1. Lie flat on your back for the first 30 seconds. Step 2. Place your dominant hand on your belly, just below your rib cage. Place your other hand gently on your chest. Step 3. Take a normal breath in, then exhale completely to empty your lungs. Step 4. Inhale slowly through your nose for a count of 4. The hand on your belly should rise. The hand on your chest should barely move. This is called diaphragmatic breathing, and it is critical that the breath comes from your belly, not your upper chest. Step 5. Gently hold your breath for a count of 7. Do not strain. If 7 seconds feels too long at first, hold for 5. You will build up over time. Step 6. Exhale slowly through pursed lips for a count of 8. Make the exhale longer than the inhale. This is the critical step. It is the long exhale that activates the vagus nerve most powerfully. Step 7. Repeat one more time. 2 complete cycles total. After your second cycle, take 1 normal breath, then slowly roll onto your side. Sit up gently. Place your feet on the floor. Sit on the edge of the bed for an additional 30 seconds before standing. This entire protocol, including the gentle wake-up, takes less than 90 seconds. Now let me share a few practical tips to make this work consistently. Tip 1. Place a small handwritten note on your nightstand that simply says 478 until the habit becomes automatic. Most seniors who try this and stop because they forgot, not because it did not work. Tip 2. If you wake up to an alarm, set it 90 seconds earlier than you normally would. Do not skip the breathing to save 90 seconds. This is the most important 90 seconds of your day for your heart. Tip 3. If you wake up multiple times during the night, you can do this breathing exercise each time. It will help you fall back asleep and will support your cardiovascular system overnight. Tip 4. After about 30 days of consistent morning practice, you will likely find yourself wanting to do this throughout the day. Listen to that instinct. Use the technique whenever you feel stressed, before meals or before bed. The vagus nerve responds to repetition. I want to be honest with you about something. Not every senior will respond identically to this practice. There are a few situations where you should be aware and adjust accordingly. If you have chronic lung disease, such as COPD or emphysema, the 4-7-8 timing may be too long for your lungs to handle comfortably. Adjust the counts to whatever works for you. A 3-5-6 pattern is fine. A 2-4-6 pattern is fine. The most important rule is that your exhale should be longer than your inhale. That is what activates the vagus nerve. If you have congestive heart failure or any active cardiac condition, please show this video to your cardiologist before beginning. The technique is generally safe, but your doctor knows your specific situation. If you experience dizziness during the breath hold, shorten the hold significantly. Some seniors do better with a 4-2-6 pattern instead of 4-7-8. Find what works for your body. The technique is forgiving. If you take blood pressure medication, this technique may amplify the effect. Over time, you may find that your morning blood pressure readings have improved enough that your doctor reduces your medication dose. This is a wonderful outcome, but never reduce medication on your own. Always work with your physician. Let me share one more patient story. Margaret, 76, from Charleston, South Carolina. She had been taking 3 different blood pressure medications for 12 years. Her morning blood pressure averaged 158/92. She began the 30-second morning breathing protocol in March of last year. By June, her morning readings had dropped to 138/84. Her cardiologist took her off one of her medications. By September, her readings were averaging 128/78, and her cardiologist reduced a second medication. She is now on just one medication, takes 30 seconds in the morning, and her cardiovascular markers are better than they have been in 20 years. I share Margaret's story not because every person will have the same experience, but because the body's capacity to respond to this simple practice is genuinely remarkable when given the chance. The 30-second breathing habit is the foundation. But if you want to truly maximize your heart protection in the morning, here are 4 additional habits to layer on top. Habit 1. Drink a glass of room temperature water within the first 5 minutes of getting out of bed. After 7 to 9 hours of sleep, your blood has become slightly thicker due to dehydration. Thicker blood is harder for your heart to pump. It increases stroke risk and clot risk. A simple glass of water before any coffee or food restores blood volume and reduces strain on your cardiovascular system within minutes. Habit 2. Move gently for 5 to 10 minutes before any vigorous activity. If you exercise in the morning, do not jump straight from bed into intense movement. Start with gentle range of motion exercises. Roll your shoulders, stretch your arms overhead. Walk slowly around your home. Allow your cardiovascular system to wake up gradually. Habit 3. Delay your first cup of coffee by at least 30 minutes. Caffeine on a freshly awakened cardiovascular system amplifies the morning surge. By waiting 30 minutes, you allow your blood pressure to rise naturally before adding the caffeine effect. This single change has been shown to reduce morning blood pressure spikes by another 5 to 8 millimeters of mercury. Habit 4. Eat a small, fiber-rich breakfast within 60 to 90 minutes of waking. I am not asking you to eat a feast. A bowl of oatmeal with a handful of berries and a tablespoon of walnuts is enough. This combination supports stable blood sugar, provides cardiovascular protective fiber, and gives your body the steady energy it needs to handle the day without spikes and crashes that strain your heart. When you combine the 30-second breathing technique with these 4 additional habits, you have created what cardiologists informally call a heart-protective morning protocol. The cumulative effect over months and years is dramatic. If you have made it this far and you are getting value from this video, please hit the like button. It tells YouTube that this content matters to seniors, and it helps the algorithm push it to more people who need to see it. I want to close with something that has nothing to do with science. You have spent decades doing the right things for your health. Maybe you quit smoking 20 years ago. Maybe you watch your diet. Maybe you take your medications faithfully. Maybe you walk every day, just like Walter did. And somewhere along the way, no doctor ever mentioned to you the most dangerous 60 minutes of your day, or what you could do for free in 30 seconds to dramatically reduce the risk during those minutes. That is not your fault. The medical system is built around prescription pads and procedure rooms, not around teaching simple, ancient, free techniques that have no profit attached to them. But here is the truth. Your heart is not just a pump. It is the muscle that has carried you through every joy, every grief, every celebration, every quiet morning of your life. It has beat over 2.5 billion times by the time you are 65. It deserves your attention. It deserves your care. It deserves 30 seconds. You do not need to wait for the next doctor's appointment. You do not need a prescription. You do not need to buy anything. You do not need to be in good shape. You just need to wake up tomorrow morning, place a hand on your belly, and breathe slowly twice. That is it. And if you do that consistently for the next 30 days, the changes in your cardiovascular health may genuinely surprise you. Your blood pressure may drop. Your resting heart rate may slow. Your morning anxiety may fade. Your sleep quality may improve. You may walk into your next cardiology appointment and watch your doctor look at your numbers, look up at you and say, "Whatever you have been doing, keep doing it." That moment is available to you. It starts tomorrow morning. It costs nothing. It takes 30 seconds. Now I want to hear from you. Drop a comment below and tell me one thing. Will you try this tomorrow morning? Just type yes if you commit to trying it just once. That commitment made publicly makes you 4 times more likely to actually do it. The research is clear on that, and if anyone you love is over 65, please share this video with them. Most seniors will never learn about vagal breathing on their own. They will never see this research. You might be the only person who tells them what could be the most heart-protective 30 seconds of their day. If this video gave you a single piece of information that you did not have an hour ago, please hit the like button. It tells YouTube to show this video to more seniors who urgently need this information. Subscribe to this channel and hit the bell. Every week, I publish content like this, designed specifically for adults over 60 who want to take control of their health in ways the medical system never taught them. Next week, I will be covering the 3 evening habits that quietly extend your heart's lifespan by years. One of them is something almost no senior is doing, and the data behind it is remarkable. You will not want to miss it. Until then, breathe slowly. Protect that heart. It has been carrying you for a long time. It deserves these 30 seconds. I am Dr. Franklin. I will see you in the next one.